are the complications of varicose veins? Skin changes associated with varicose veins are a sign of advanced venous insufficiency that can lead to severe complications if left unmanaged and untreated. These complications generally arise from chronic pooling of blood that increase the pressure in the veins. Then there is venous hypertension and leakage of fluid and other blood components into the surrounding fat and skin. Here is a breakdown of the potential complications: varicose eczema, venous dermatitis or stasis dermatitis. Normally, people go visit the skin doctor or a dermatologist with respect to darkened skin and itchy skin. The symptoms: the skin over the varicose veins become itchy, red, dry, flaky, and sometimes even blister, or sometimes they may become weepy. Complications: persistent itching can lead to scratching, which can break the skin barrier, increasing the chance of bacterial infection, something called as cellulitis. Chronic inflammation can also cause the skin to thicken and become thick or leathery. Now, one of the most serious complications is lipodermatosclerosis. This is a more serious complication where the skin and the subcutaneous tissue of the lower leg become inflamed and hardened and tight. The skin may also become discolored, generally reddish brown or slightly blackish. In severe cases, the leg can take a inverted champagne bottle shape, where the ankle is narrow and a wider calf is available. Now, coming to complications of lipodermatosclerosis, it can be painful, it can limit mobility. Hardened tissue are more prone to injury, as well as they are less likely to heal. It is also a significant risk factor for developing a venous ulcer. Hyperpigmentation, another skin issue that leads to skin staining. Symptoms are the skin around the varicose veins, particularly near the ankles, become discolored, often turning brownish or rust color. They are often due to leakage of blood cells into the tissue and deposition of iron containing pigment hemosiderin. While most of it is cosmetic concern, hyperpigmentation indicates a chronic venous insufficiency and underlying tissue damage. The discolored skin can also become fragile. Something called as atrophic blanch is another skin issue. These present as smooth, ivory white and often star-shaped patches of skin surrounding the dilated capillaries. Sometimes the hyperpigmentation usually occurs near the ankles. Now, what are the complications? Skin in these areas are thin and fragile, making it susceptible to ulceration. Venous ulcer, the most dreaded complication. These are often sores that are typically developed on the lower leg, around the ankles on the inner aspect. They can be very painful and discharge fluid, and they take a hell lot of time to heal. The surrounding skin may show signs of other skin involvement like thickening and lipodermatosclerosis. Now, varicose ulcers are difficult to heal and they are prone to infection. Chronic ulcers can significantly impact the quality of life, causing pain, limiting mobility, requiring long-term wound care and several hospital visits. In several untreated cases, infection can spread to other parts of the body, leading to serious complications. Before you end up with complications of varicose veins, it's better you reach out to your doctor, get yourself assessed, whether you require treatment for varicose veins, let it be conservative treatment with stockings, some pills, or let us say some exercises, or you may require surgery. Do not reach at a last stage when you have bleeding, or let's say you have an ulcer and then you're trying to seek out treatment. It's better you reach out to your surgeon much earlier and sort it out at an early date. The recovery is much better, the complications are much better, your visits to the hospital decreases. I hope this was informative. If you suffer from varicose veins, please reach out to your doctor, as well as if you have any concerns, you can drop in your comments. I'll get back to you. Thank you for your time.